It's a common form of arthritis affecting the part of the thumb right next to your wrist. So we're discussing basal thumb arthritis. This is A Bone to Fix, a podcast from the Centers for Advanced Orthopedics. I'm Joey Waller, and I've got a bone to fix with you. Thanks for listening. Welcome to our series segment called Hands On, focusing on different parts of the hand from fingertip to wrist. Today, we are indeed talking thumbs. Our guest, Dr. Brian Jans, a hand and upper extremity surgeon with Orthopedic Associates of Central Maryland Division. Dr. Jans, thanks for joining us.
Oh, happy to be here to discuss arthritis with you.
And happy to have you here to discuss it. So first, simply put, what is basal thumb arthritis?
So basal thumb arthritis is a very common arthritis that we see at the base of the thumb, more technically the base of the metacarpal, which really affects individuals as we age, usually after 40, 50 years of age, really limiting grip and weakness and increasing weakness involving the hand.
And so what causes this condition other than simply the age process?
The vast majority of the time, if you're going to have arthritis at the base of the thumb, it's due to osteoarthritis or wear and tear arthritis of the bone.
And so would anything we do in everyday life increase or decrease our chances of succumbing to this condition?
That's a tough one to answer. A lot of times the arthritis is more due to wear and tear and even sometimes genetics. Although there's no specific cause of the basal joint arthritis, repetitive activity, genetics, and trauma can all add up to leading to decreased cartilage, which will lead to more bone-on-bone rubbing, leading to progression of the arthritic process.
So what are the basic symptoms of this basal thumb arthritis?
So the usual symptoms for basal arthritis of the thumb are weakness and pain and discomfort, especially with gripping.
And would that tend to happen more in our dominant hand?
It's variable. Some patients it'll show up in the dominant hand, and some patients it'll show up in the non-dominant hand. So there is a bit of variability to it.
And I guess, like with many things in life, until this injury or condition occurs, we don't realize just quite how much we use those thumbs, right, Doc?
Absolutely. And actually, in most situations, if we do an x-ray of a hand that's arthritic, we may see changes in the x-rays even prior to the thumb being symptomatic.
So this is something that could be laying dormant for a while then before it's even officially diagnosed. Speaking of which, how do you diagnose it?
Diagnosis is usually performed with a clinical examination, a very specific examination, especially to the thumb, where we manipulate the base. And if there's discomfort and pain, that's considered to be a positive grind test. And that's pretty indicative of inflammation or arthritic changes involving the base of the thumb. So at that point, we would do x-rays of the thumb. And in those situations, we usually see decreasing cartilage, decreasing space of the joint, or increasing irregularities consistent with the osteoarthritis. So the x-ray is usually extremely important for the diagnosis of this condition.
How does basal thumb arthritis, doctor, differ from carpal tunnel syndrome?
Basilar joint arthritis is going to be aching and pain and weakness when gripping, and the pain is almost very specifically to the base of the thumb, right above where your radius is, or the long bone. Now, carpal tunnel syndrome is going to be more numbness and tingling in the thumb, index, and middle finger, and then weakness over time if it gets more severe. Now, with carpal tunnel syndrome, you're going to see more symptoms at night when you're sleeping, and also during the daytime with numbness, aching, and pain. Now, that's also involving usually the thumb, index, and middle finger, and sometimes part of the ring finger. The basilar joint arthritis is not going to be so much numbness, but more aching, very specifically to the base of the thumb.
Do people, I'm almost afraid to ask this, do people ever get both of those?
Yes, actually, they're pretty common to have them both at the same time. And we'll go ahead and treat them, especially if they're mild, with conservative management for both the carpal tunnel syndrome and the basilar joint arthritis.
So let's talk about treatment. What do you do for basal thumb arthritis?
So non-surgical treatments usually revolve around anti-inflammatories and settling down any inflammation. So NSAIDs, aspirin, naproxen, all work well initially to help decrease the inflammation, and then immobilization. So we'll use a series of either small, medium, or large size thumb splints in order to decrease some of the discomfort. Now, you don't have to wear the splints all the time, but usually when you have a flare or discomfort, we have patients put the splint on to go ahead and settle down some of the discomfort that they're having.
Yes, splints are interesting, I think, in general, because I've had to use them a little bit myself, in that I think a lot of people that haven't tend to associate splints more with recovering from an injury, but you're talking about, you use the term settle down. Sometimes using a splint can simply keep a part of the body from moving, and that in and of itself can allow it to heal, right?
Correct. If you're having inflammation of the joint, it's sort of, in this situation, you want to hit a happy medium. You don't want to immobilize so long that the joint gets stiff and your arthritic process worsens, but you also don't want to keep on moving once it's inflamed. So you want to settle down the inflammation with the splint and then get back to a happy medium and then start using the joint again. And if the splinting and NSAIDs aren't working, or if you can't take the NSAIDs, then sometimes corticosteroids are a good option. And sometimes we'll do a Medro dose pack to go ahead and decrease some of the swelling. Or another great option is to do steroid injections directly to the joint. Now, it doesn't reverse the arthritic process, but it does minimize the symptoms. You can get some fairly significant relief, especially with mild arthritis, with steroid injections to the joint.
And what if surgery is needed?
Now, surgery usually is an option if you're not responding to conservative management, or if you have really severe arthritis where it doesn't look like you're going to improve with conservative management. And in those situations, then we will perform what's called a basal joint arthroplasty, which can be done in a couple different ways, where we remove a bone and sometimes part of a second bone, and we tighten up a ligament to go ahead and stabilize the thumb. And the outcomes for those tend to be pretty good. Now, if you have arthritis and you're younger and you're a manual laborer, sometimes a joint arthroplasty is not your best option. In those situations, we'll fuse the joint with the metacarpal and some of the smaller bones in order to decrease the bone-on-bone rubbing.
So it sounds like you're saying then that age and wear and tear that's already taken place is a factor in trying to determine the best course of action, yeah?
Correct. Yes, and also what you do for a living. If you're going to be lifting 100, 200 pounds, then chances are a basal joint fusion may be a better option if you're younger as opposed to a basal joint arthroplasty.
Now, what's not commonly known is that a thumb, correct me if I'm wrong, doctor, is considered to be not technically a finger, but a digit whose opposable nature gives us an advantage over most other mammals, right?
Correct. Now, most hand surgeons will say that you have 4 fingers in one hand and a thumb. And the thumb basilar joint is designed a little bit different, almost like a saddle joint. And I think that, to some degree, also predisposes you with opposition to a little bit more arthritic changes to that joint versus the other joints.
And so when we say that the opposable nature makes us different from other animals, what does that mean exactly?
That means that our thumb actually is rotated in such a way that we can grip and use the thumb in a different plane as opposed to the index, middle, ring, and small finger. And that's largely due to the basilar joint.
And so that, again, is one of the things that makes us different from other mammals. I probably learned that in school somewhere along the way, but it's been so long that it's good to get a refresher from you here today, right?
Absolutely.
Never too old to learn. Well, folks, we trust you're now more familiar with basal thumb arthritis. Dr. Brian Jans, thanks so much again.
Thanks for having me.
And for more information or to make an appointment, please visit mdbonedocs.com. Again, that's mdbonedocs.com. And that was A Bone That's Fixed. If you found this podcast helpful, please do share it on your social media. Hoping your health is good health. I'm Joey Waller.